Good afternoon. On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Virtual Nursing, an Innovative Solution with Positive Patient Safety Implications. My name is Kelly Gibson, and I will be your moderator for this program. We welcome any comments or questions. All materials are provided for your educational use. Now I'd like to introduce our speakers for the webinar. Dr. Fallon Hughes is the Senior Director of Nursing Practice, Innovation Research, and EBP for WellSpan Health. Fallon has served in many roles throughout her 16-year career in nursing, including clinical positions in adult oncology and hematology, quality, patient safety, nursing professional development, and leadership. Alisha Wike has worked at your WellSpan Good Samaritan Hospital for over 13 years as a bedside nurse after graduating from the Reading Hospital School of Nursing in 2010. She has cared for patient populations that include cardiac telemetry, medical, surgical, and neuro. Alisha has been greatly involved with and advocates for the virtual nursing platform. None of the planners for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Fallon, I will now turn the program over to you.
Thank you, Kelly, and thank you all for taking some time to join us today to talk about this important topic. I'd also like to just recognize my colleague, Alisha, who doubles as a bedside nurse and virtual nurse for us at WellSpan Health Good Samaritan Hospital. And she's made the time to join us today and add her expertise to the presentation. Just to highlight our educational objectives for the next hour, we're going to discuss evidence on the role of the virtual nurse in healthcare, the role of the virtual nurse in an acute care or hospital setting, compare some virtual nurse operational considerations to those of traditional nurse staffing models, of course, discuss implications for patient safety, and interpret our virtual nurse implementation outcomes at WellSpan and how this could apply at your facilities. This is my less formal agenda outline for today. We're going to talk about who is WellSpan Health, what is virtual nursing, our process design for implementation of virtual nursing, our outcomes so far, and implications for patient safety. And we will have time at the end for question and answer. So please feel free to jot those down as we're chatting today, and then hopefully can address those at the end. I will also share my contact information at the end for anybody who isn't able to get their question answered and would like to chat afterwards. I would invite that. So let's get started with who is WellSpan Health. WellSpan is a large healthcare organization located primarily in South Central Pennsylvania and areas of Upper Maryland. We are 23,000 team members strong. One of our core values at WellSpan is working as one, which, as those of you who are in large healthcare systems can relate, is challenging across such a large geography, but I think we do a great job. We have around 3,000 providers working with WellSpan patients, 250 unique patient care locations in the medical group and ambulatory setting, 7 acute care hospitals, 2 specialty hospitals, 7 ambulatory surgery centers. We have a large behavioral health network within WellSpan, home health, and visiting nurses association as well. And for my nurses on the call today, we have 1 magnet facility and 3 pathway facilities among our 9 hospital system. So, what is virtual nursing? I put the slide in here not so much to read the actual words, but just to make visual for you that we as a discipline and really as a healthcare entity across the country have not quite landed on a universal definition of virtual nursing. So you'll see a virtual nursing care delivery model, virtual nurses using telecommunication, electronic health records, and other tools to extend their practice across geographical boundaries. A rapidly growing area of healthcare that utilizes technology to deliver nursing services, working in an augmented care environment where a virtual team provides support to the bedside team. And virtual nursing refers to patient care that is delivered from a remote location. And if anyone's interested, I can share the references for all of these definitions, but would also like to highlight that we have the American Nurses Association as our largest professional governing organization for nursing in the United States. And they have yet to publish a formal definition of virtual nursing or determine, is virtual nursing a specialty like critical care nursing? Is it a modality of providing nursing care? Is it a unique care delivery model? All of those things are questions that still need to be answered by our larger governing bodies. And I have the great honor of serving on the ANA's virtual nursing issues panel that has just been stood up a couple of months ago to help to try to define some of these things for those of us who are working in this space. So more to come, but that's an important thing to realize when you're on a virtual nursing journey. We still have a lot yet undiscovered. So why virtual nursing for WellSpan Health? Why did my organization, or perhaps you're sitting in an executive or leader seat wondering why your organization should embark on this journey? For us, there is a vision of an intersection between people, processes, and technology. In other words, we are hoping to innovate our workforce, not by adding more technology and less people, or more people and less technology, but how do we balance our people resources, our continuous performance and process improvement resources, and the technology at our fingertips to provide the best patient care that we can. And that's where we believed virtual nursing came in. Secondarily, we also hoped with this project that we would positively impact nurse engagement as well as patient safety and experience. And I'll share some of our outcomes in those areas a little later in our webinar. Just for reference, for those who may be unfamiliar, the picture on this slide is the front of WellSpan Good Samaritan Hospital, where Alisha works and became our second pilot site for our virtual nursing platform. When an organization is going to engage in developing a virtual nursing platform, there are a couple of important pre-implementation decisions that need to occur. This slide highlights some of the key decisions that my organization, WellSpan Health, needed to decide. I would invite you while I'm chatting to share in the chat to all participants what are some other pre-implementation decisions that you think would be important at your organization that I perhaps won't highlight. From my perspective, there were three key pre-implementation decisions that needed to be made. Ownership is first and foremost. Who will own the wins, losses, and everything in between, right? Is this information technology? Is this nursing? Is this the corporate senior leaders? Is this nursing informatics? I think the answer is slightly different depending on the organization makeup and structure. For WellSpan, it was very important that ownership was a shared responsibility between nursing leaders, including our chief nurse executive, information technology leaders, and nursing informatics to make all of the pieces come together from the start. I think the second key pre-implementation decision is who your vendor partner will be. You're living in a bubble if you aren't constantly getting email blasts from various technology vendors wanting to partner with your organization using the software and tools that they've developed. I do think this is a key factor in starting up your virtual nursing program because this is truly something that requires constant collaboration. You need to be clear on what your expectations are with this vendor partner and what your journey is going to look like. Are they going to be willing to learn alongside you and optimize their technology as you trial different opportunities and provide feedback? What is the cost? What sort of infrastructure is your building going to require to be able to use the technology? Do you need to purchase new TVs for your patient rooms, pillow speakers? All of those sorts of things will vary by vendor and may be really important in your decision making. And then lastly, your pilot site. Where are your early adopters? Where do you already have existing infrastructure that will support the technology? Where do you have engaged leaders and staff? So for WellSpan Health, we chose one of our specialty hospitals, WellSpan Surgery and Rehabilitation Hospital, as our initial pilot site because there were several positives when it came to our checkboxes for a pilot site. This is our newest facility, so technology infrastructure challenges didn't exist. This facility had great employee engagement scores and leader scores on employee engagement and had often been utilized to pilot other technology. So we felt like it was going to be a great fit for our first site. So just some important things to keep in mind as you venture into this journey or perhaps are already getting started. But certainly this is not an exclusive list. A couple of key milestones to share. So just about a year ago now, WellSpan Health implemented their virtual nurse and virtual observer program. Virtual nursing, we've talked about a little bit already in reviewing the definitions of what a virtual nurse is. And we'll talk a little bit more on the next slide about the use cases for a virtual registered nurse. A virtual observer is slightly different and typically serves as a nursing assistant or certified nursing assistant to provide virtual observation. So these are your patients who would have formerly required a one-to-one live patient sitter in their room to keep them safe from falling, from pulling out medical devices, from wandering out of their room. But with this program, we've been able to successfully move a lot of those patients to virtual observation where they're still receiving care that ensures their safety, but is also a more efficient way to spread our resources, because the virtual observer can observe up to 10 patients at a time in the virtual environment versus one patient at a time in a one-to-one setting. So about a year ago, we went live with both of those programs at our WellSpan Surgery and Rehabilitation Hospital. After roughly 6 to 8 weeks, it was deemed that the pilot was successful and the spread plan begins. And I say through present day because we're still spreading our virtual nursing program throughout the system. As of July, we were officially live at 6 of our acute care hospitals and the one specialty hospital, which was surgery and rehab. But that pilot time period was really critical in understanding where our barriers were going to be, where our early and easy wins were going to be, how to get staff bought into this technology, how to ensure our patients were safe and comfortable with the technology. Throughout this time period, WellSpan Health had the opportunity to participate in a learning and action network collaborative with the Institute for Healthcare Improvement. And during this collaborative, WellSpan participated with 4 other healthcare organizations who were also implementing innovative nursing workforce solutions. And so through this collaborative, we were able to use the opportunity to PDSA, or Plan, Do, Study, Act, many small tests of change with our virtual nursing program so that we could continue to optimize the role of both the virtual nurse and the virtual observer throughout our spread plan. So that was also really positive and impactful. Now, I would say you don't have to be engaged in a project with the IHI to do that exact same thing, right? You have to engage your performance improvement or your process improvement team at the beginning of the project to say, hey, how do you help us stay nimble and continue to try and test different opportunities with this system? So that's another group of key stakeholders that should stay involved. And then lastly, where are we at right now? We are scaling our virtual nursing programs in different arenas. So we primarily started in med-surg units and now are scaling to ICU areas and determining what use cases are appropriate for the virtual nurse in an ICU setting. For those of you who are familiar with lean methodology, we utilized a Kaizen or a rapid improvement event each time we were evaluating our use cases for the virtual nurse. So we pulled in our clinicians and frontline staff from the hospital setting to help us understand, back to our original why of the project, what can we do to keep our nursing staff engaged and improve their work-life balance? What can we do to improve our patient experience and patient safety with this technology? And that's where our frontline staff were really able to help us maximize the program. I noted some AI, or artificial intelligence, challenges here shortly after our go live, and I'm going to talk about that a little bit more in depth in an upcoming slide. This slide highlights the PDSAs, or tests of change, that we have trialed throughout our virtual nursing program. The green items highlight those things that we have tested and fully implemented as a role for the virtual nurse. And the blue items highlight items that we are either still testing or are planning to test in the near future as additional use cases and activities for our virtual nurse to complete. So I shared that we had some challenges with our artificial intelligence, and I want to take a minute or two to talk a little bit about this. Artificial intelligence is a hot topic in the healthcare arena, as well as other industries. And with the particular software that we are using at WellSpan Health, there is an artificial intelligence component specifically for the purpose of preventing patient falls. So, as the virtual nurse is monitoring the patient on the computer screen, the AI is working in the background to monitor the patient behaviors. And if the patient begins to display behaviors that are likely to result in them getting out of bed, or they're already attempting to get out of bed, the screen is going to change from a greenish color to either yellow or red to indicate, hey, we might have a problem here. Pretty cool technology, but our challenge was that this AI learned the patient's behaviors by following a hospital gown. However, you might remember that our initial pilot site was a surgery and rehabilitation hospital where our patients don't wear hospital gowns. They're actually encouraged to wear their own clothing because of the hours they're participating in rehab. So we had to test different options for the AI to be able to learn our patient behaviors. We trialed things like sports pennies and scrub tops, and as you can imagine, patients really didn't like wearing these extra articles, and in some ways we felt like it almost called them out or put a visual that we didn't really like either. Ultimately, we were able to train the AI to follow the patient's behaviors via their medical patient ID band and the yellow no-slip socks that we have them wear. So just an example of the importance of selecting a vendor who will partner and learn along with you. Because this was really a collaboration between our vendor and WellSpan to say, hey, the way your product works now isn't going to work for our patients because we like our patients to be able to wear their own clothing. And we were able to come to a resolution so that these patients can still benefit from that additional safety layer with the AI. Before I talk about outcomes from our virtual nurse program, I am a storyteller and I love to share real life stories. I think it speaks more than numbers at times. So I just want to share a couple things here. This first quote is from one of our virtual nurses at WellSpan Good Samaritan Hospital. His name is Dalton Heisey. He's wonderful. And he says, I performed as a floor nurse for 7 years and was interested in pursuing a new path. What Dalton doesn't say here is that he actually was thinking about resigning. He was offered the virtual nursing position at Good Samaritan, and the position has extended him the opportunity to evolve in numerous ways, including team building with multiple coworkers, providing coworkers with the ability to share more quality time with their patients while still giving the opportunity to continue to grow in his field. So again, if you remember, what were our whys for implementation of a virtual nursing program? Nurse engagement was one of our top 3 priorities. And then the second quote here actually was shared from Alisha early on in program implementation. So Alisha, I'll just invite you to come off mute and share your quote here and anything else that you'd like to add about your overall feelings of the role.
Good afternoon. So my quote was, "When I leave at the end of my shift as a virtual nurse, I am feeling very accomplished. Knowing that I've impacted a nurse's day for the better is very gratifying. The one-to-one time spent with a patient without distraction, especially for educational purposes, means a lot to me personally. I really enjoy that teaching part of my job as a nurse, and I'd lost that ability at the bedside over recent years for numerous reasons. When I'm in the virtual nurse role, I'm not stressed out as much as I am at the bedside. I have more clear-mindedness and clarity while working in this role. Overall, I do feel it has significantly impacted my overall nursing stress levels. Lastly, I have much more energy on my days off, which is of great significance to me."
Thank you so much, Alisha. And I'll just add that I had the opportunity to shadow Alisha one day, and she shared with me that even, I believe it was your husband, Alisha, you said that he even noticed that when you came home at the end of the day, your stress levels were improved. And just, in my opinion, a great example of offering a unique position within nursing that can really help to improve the work-life balance for folks who may need a change. This is a great example of the impact of the virtual nurse program on our bedside nurse experience and engagement. I won't read this full paragraph to you, but this is from Laura Wampler, who is one of our bedside nurses. And she shares about an experience where she had an early discharge at 7:30. Of course, she just started her shift at 7, was trying to get report from the off-going nurse. Of course, the patient who was being discharged wanted to get out. The family was ready to go. This nurse had several other patients waiting for their morning medications. And so this was a great opportunity for the virtual nurse on duty to step in, take over, manage the discharge for this patient, including reviewing the instructions, educating, and even setting up the transportation for the patient to get to their vehicle with their family. And this nurse just shares the impact of that experience then on the rest of her 12-hour shift, that she had that help at the beginning and then was able to move on and have a great day. And then just a couple examples from the patient side of things. Here's a great patient safety example where we had a virtual nurse who was able to identify that the patient was about to be discharged and hadn't received various medical equipment items that they were going to need at home. The virtual nurse was able to step in and make sure that the patient had what they needed. So we certainly prevented a potential readmission, had the primary nurse not recognize the missing equipment, and of course, time saved at the bedside, which is precious. Another quick story that I want to share with you that I think also impacts the patient and family experience. This was shared to me by one of our nurse managers at Surgery and Rehabilitation Hospital. And she says, "We had a patient here who had been in the acute phase of hospitalization for a while, weeks basically. The patient was encephalopathic and needed peritoneal dialysis. By the time he came to rehab, he was severely debilitated and unable to verbalize his needs. The patient's wife had been spending most nights with him. She felt like she couldn't leave him because she was the only one who understood what he needed and helped to keep him calm. She was very involved and focused on ensuring he participated in his therapy and rehabilitation. The care team felt the wife was stressed out and did not have confidence in our abilities to provide the safest and best care due to her husband's impairment, as well as some experiences they had had at other hospitals. Casey, our nurse manager at this facility, was able to meet with the patient's wife and share about our virtual nursing and virtual observation program. The patient's wife was impressed that our team was able to monitor her husband and redirect him to keep him safe. That night, she still felt concerned and stayed the night with him. However, Casey, the nurse manager, told her she would follow up the next day to check on her. The next day, Casey came in, and to her surprise, the wife was not there. She had decided to go home and take a shower and get some rest. And the wife shared, I went home because I knew you had that patient monitor. And she heard them help to redirect him a few times, and it worked. She said he was responding to them, and she felt comfortable and safe to be able to go home. So I think just a great testament also to how this program can positively impact family members as well. This next slide here has several patient safety great catches to highlight. Some of these I think are probably not surprising to those of you working in healthcare. Like, I love these examples where the virtual observer was able to catch a situation where the patient wasn't to be eating or drinking and was about to. This first one here is a great example. The virtual observer caught a patient going into respiratory distress and was able to call a rapid response before leading to a code. This last one here, a patient, the virtual observer saw a patient in a bedside chair and realized that the chair was moving because the wheels weren't locked. So again, the virtual observer having eyes in that room could notify the nursing assistant to go in and lock the chair. So lots of great examples there. The next two slides, you're gonna see a lot of data, and I'm just gonna kind of quickly highlight some key outcomes for you that we've experienced so far. So this slide is specific to WellSpan Surgery and Rehabilitation Hospital, where our virtual nursing program has been live for roughly a year now. This first slide, you'll see our falls rate from time of the gray box there is virtual nurse go live through the end of May of this year. So we've had a very nice decline there. Nursing turnover is something that we were monitoring as it relates to our goal of improving nursing engagement across WellSpan Health. So you'll see we had a really nice trend, and then you see this interesting spike. I'll share with you that at this exact time frame, we transitioned to a new HR system at WellSpan Health. So this data is interesting, and not quite sure how we interpret it yet, other than to say we were on a great trend, and then we implemented a new HR system. The third graph here is probably what I'm most excited about. This top question here we asked on pre, mid, and post implementation surveys with our nurses in terms of patient safety. So you can see the positive trend here relating to how our staff perceived patient safety and quality improvement as it related to the virtual nursing program. These two graphs here at the bottom are patient experience improvements. So our nursing overall patient experience bundle and our discharge overall patient experience bundle. Huge improvements in those areas. And then this last graph here is our bedside nurse time saved. The way that we are calculating that data, we again used our lean tool of performing Gemba walks, and really did a lot of shadowing to understand how long it takes a bedside nurse on average to complete various activities that our virtual nurses are now able to complete. And so right now this data is somewhat of a manual tracking of how many tasks or activities did the bedside nurse perform, and what does that equate to then in terms of bedside nurse time saved. And so this graph is displaying hours per month of bedside nurse time saved. And then this second data slide here is specific to WellSpan Good Samaritan Hospital, which again was our second pilot site. Here you're going to see the RN turnover. Now this is, again, this looks much more positive than the previous slide, but I will have to call out the same caveat that at the time you see this drastic change, we implemented a new HR system. So take that with a bit of a grain of salt there. We have also experienced pretty positive patient experience improvements at WellSpan Good Samaritan Hospital as well, which you'll see on the bottom two slides. The bedside nurse time saved there in the bottom right. And then these top two were our nursing engagement or nursing experience results for pre, mid, and post implementation. So in our last 10 minutes or so before we move into question and answer, I would like to take the opportunity to interview Alisha, who we're lucky enough to have on the webinar with us today, to give you a little bit more of a vision into the life of a virtual nurse. So Alisha, I'll invite you to unmute yourself and share what a day in the life of a virtual nurse looks like. So what are you typically doing when working in this role for an 8 or a 12-hour shift?
So at this point, my typical day is logging onto the computer. I'm sending out a secure chat to notify the charge nurses on the med-surg units that I am available, the length of stay that I will be there, usually 7A to 7P, and basically telling them, let all your staff know that I am here, reach out to me with any educational needs. I'm available to do admissions and discharges. And I'm pretty proactive at sending secure chats when I see those opportunities. Just a gentle reminder to that bedside nurse that I'm there, I'm available. If they feel the patient is willing to participate with the virtual nurse, then I go ahead and take that opportunity and utilize that.
Thank you, Alisha. And in your role as virtual nurse, are you located in the hospital or where are you primarily located?
Yes, I am located in the hospital. At this point, we don't have anyone working from home, but I think down the road, there was some discussion about maybe trialing that route. But currently at Good Sam, we have 3 virtual nurses primarily who are filling that role, but there are other nurses that will fill in from time to time. So we are located on 3 South in a conference room that was converted into the virtual nurse room.
Thank you, Alicia. Alicia, how have your peers or bedside frontline nurses responded to your role as a virtual nurse and the program at Good Samaritan?
So the response has actually been very good. Initially, there were a few nurses who were a little leery to use it. I think most commonly they felt that, why would I have a virtual nurse do it when I can go and do it in person? But after they actually allowed the virtual nurse to do an admission or a discharge, they realized that that virtual nurse was actually able to provide more one-to-one time. They were able to spend more time essentially at the bedside, answering more questions, maybe reviewing education a little bit longer than what the bedside nurse would have the time frame to do, given that they have a 6-patient assignment. Um, I don't think at this point that there are any nurses within this hospital that would say, no, I do not want to utilize a virtual nurse to help me with admissions, discharges, or education. Most everyone is reaching out to us asking for that help now.
That's wonderful. So, along those same lines, how have patients responded to this program? Any challenges or mostly positive as well?
Mostly positive as well. There are a few patients who, for whatever their reason, are not receptive to that virtual nurse. Um, I feel like it's very patient specific. So there might be, several reasons that one person doesn't want to utilize it. Um, Probably the times that we don't utilize it when we want to are for the patients that have some kind of hearing impairment. I think that those have been the most challenging patients if they are not able to hear the virtual nurse well enough, or to the patient it might sound muffled or maybe it's too loud. Those are the ones that we usually have to kind of step away and say, you know what, we tried it, it did not work, and then we just reach out to that bedside nurse and let them kind of take over and handle that situation. Very few patients will outright refuse to use it. Almost everyone is willing to try it, and then at the end they'll kind of let you know, I did not like this, I don't want to do that again. But I don't know, I've been doing this now for what, at least 9 months, I guess almost a year. I have had maybe a total of 5 patients that I've worked with who have said, I don't want to do this again.
That's wonderful, Alicia. Thank you. And I've had the opportunity to shadow Alicia and some of uh, our other colleagues in the virtual nurse role, and have really appreciated the additional amount of time and feeling of not being rushed that you're able to provide to the patient. I think that's great. Just 2 more questions for you, Alicia. Next question, which I'm sure some folks on the webinar are wondering about, is privacy concerns. Have you heard of any nurses or patients that have concerns about their privacy? And can you share anything that is being done to protect patient privacy?
Yeah. So we have had some concerns over privacy. The way that we've tried explaining it as the virtual nurse is that, if you're in a semi-private room, whether it's the virtual nurse on the television talking to you or a nurse coming into the room at the bedside, there is the potential for that roommate to overhear some of that conversation. So the way that the speakers are currently is in a semi-private room. There is one speaker that is mounted into the ceiling, and it's usually in between the two beds. So it's in the middle of the room. So if that other patient happens to be in the room, or if they have visitors or family at the bedside, unfortunately, you are going to hear that conversation. I know that we have reached out to our vendor asking if there was any way that we could change the speaker that it would come out of the patient's call bell. That way the patient could put that speaker kind of up to their ear. It wouldn't come out, like the volume wouldn't be as loud, and it would definitely limit the amount that the roommate would hear or the visitors. So they're in the process of looking into that. The patients in the private rooms, however, I don't think that there are any complaints as far as privacy goes for that. That patient's in a room alone. We can also close the door to almost all of the rooms. So essentially, when you're in a private room, that virtual nurse can talk and there's really no one else that's hearing that conversation.
Thank you, Alisha. And I'll just add to that the technology does not record, which is something important that we share with our patients as well. So there's nothing being saved on the back end in terms of, if you think of like security camera footage or something like that, there's no recording being saved. So that generally is really helpful to patients to hear as well. And then last question for you, Alisha, if you could share from your perspective how the virtual nursing program has helped to impact the safety of our patients.
Yeah, so with virtual observation, with the nursing assistants watching, we've definitely prevented a lot of falls. We've had a lot of catches of things not being removed from the body that are not supposed to be. The virtual nurse, I know personally, I have caught a few med errors on patients' discharge that maybe a bedside nurse, in the rush of everything going on with the day, maybe could have overlooked. As one of the slides had depicted earlier, I've had patients who we've realized they don't have the equipment at home that they should. Maybe it's oxygen setup that was missed somehow, or they needed that walker or cane, and we realized that the physical therapist hadn't gotten to them yet. So I might be ready to discharge them, but we're still waiting for that piece of equipment to be delivered. We've had some patients who realized that, my doctor had mentioned I was supposed to get lab work drawn in a week, and we realized that that is not on the discharge. So I've definitely picked up some good safety things as far as that goes. It might not have affected their direct care while in the hospital, but definitely may have prevented readmission, a few days or a few weeks down the road.
Those are fantastic examples. Thank you so much, Alisha. So we are going to be moving into Q&A here in a minute, but just wanted to kind of share a final thought from one of our nurses in terms of impact on nurse engagement. This nurse had to say, I started nursing during the pandemic and had been feeling very burnt out with my time at the bedside. I appreciated that the virtual nurse role allowed me to still interact with patients, but in a manner that was more manageable yet still fulfilling. Virtual nursing is a large reason why I can see myself professionally at WellSpan Good Samaritan Hospital long term. So I think if we circle back to the whys for implementation of this program, you'll remember that it was really maximizing our workforce with a the correct balance of people, process improvement, and technology. It was improving our nursing engagement, including work-life balance, and it was improving the patient experience at WellSpan, inclusive of their safety. In a year's time, I do believe that we have achieved and continue to be well on our way to achieving those goals with our virtual nursing program, but have really enjoyed the journey and the continuous learning that is a part of implementing something new like this. So I've got my contact information here up on the screen for you. Happy to connect after the webinar. And then with that, I will turn it back over to Kelly for questions.
Thanks, Fallon and Alicia. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. I know, I think, Alicia, you were touching on this, but I want to make sure we answer, make sure we maybe even address this again, because I know you said this is always an area where people are kind of interested. How many virtual nurses are on per shift? How many patients can one virtual nurse observe? Really getting into that staffing model or what works well.
Thanks, Kelly. I'll actually jump in and take that question. This is Fallon. At WellSpan in particular, I will say it varies from entity to entity, and it varies because the technology and the structure that we have set up is different depending on the infrastructure. So at WellSpan Surgery and Rehabilitation Hospital, the virtual nurse actually has the ability to observe all of the patients in the facility. All of the rooms have hardwired monitoring equipment, and so while the virtual nurse is only going to be interacting one-on-one with one patient at a time, they have the eyes or the ability to see all of our patients. At WellSpan Good Samaritan Hospital, the model is a bit different because of the infrastructure in that facility. We are working towards that hardwired setup, but in some areas, we're also still using a virtual nurse cart. So that requires the bedside nurse to bring the cart into the patient's room, where Alisha or another virtual nurse would then dock in for a one-to-one interaction. All that to say, there is no good benchmarking or evidence-based publications yet that tell us you should use one virtual nurse for X number of patients. I've seen anywhere from one virtual nurse to 10 patients to one virtual nurse to 40 or 50 patients. And it really does vary based on your technology structure, as well as the use cases that your organization has identified for the virtual nurse.
Thank you, Fallon. That's some good information, and I'm sure you'd be, willing to work with anybody or answer additional questions related to that. Thank you. And I see, looks like Shelley posted your contact information again in the chat. So if anybody needs to grab that, please look in there for that information. There's another question about risk issues, or have there been any risk issues identified with the virtual nursing?
Yeah, honestly, we've not experienced any issues thus far. We have included the virtual care platform in our general medical consent to treat. So every patient that comes into our facility and completes the medical consent to treat is informed of the virtual care program, and that's part of the consenting process. Certainly, patients have the right to refuse interactions with the virtual care staff, as Alisha shared. there are, privacy mode options for when patients and caregivers are providing or completing sensitive activities. All of those mechanisms are in place. So really up to this point, we've not had any risk concerns.
Thank you, Fallon. I know there's two more questions, and I might try to kind of combine these a little bit because
Sure.
we're getting low on time, and I know these are important. Is virtual nursing 24/7? And then after that, I know in the data you talked a little bit about the time saved. Can you expand more how you measure that time saved at the bedside?
Yeah. So, first question. Right now, virtual nursing at WellSpan is not 24/7. That's our vision to hopefully get there. But right now, at all of our facilities, we're primarily staffing the virtual nursing role 7A to 7P or 7A to 11P. But would really are looking forward to being able to expand, particularly for the role of a virtual nurse mentor on those off shifts where we know we have younger staff working, and less experience. And then the RN time saved, we initially tried to measure that data via the electronic health record and documentation aspects. But actually, through some coaching with the Institute for Healthcare Improvement Consultants, we performed Gemba walks. So we had our performance improvement teams go out to patient care units and shadow nurses doing various activities like completing an admission, completing a discharge, providing a patient education topic. And then that team identified an average amount of time in minutes for each use case that, that a virtual nurse was going to do. So for example, if we decided that it took a bedside RN an average of 30 minutes to complete an admission, each time Alisha or one of her peers is completing an admission, that's getting counted as 30 minutes of bedside nurse time saved.
Great, thank you, Fallon. We are out of time, but I want to touch on there is one final question, and near and dear to anybody's heart that does staffing. Is the virtual nurse ever pulled to the floor?
Absolutely, yes. I could probably talk for several more hours on the staffing components of this, which really is unique to the facility. So I would be absolutely happy to connect with anybody one-on-one who's trying to build this. But certainly right now we have times where the staffing on the floor is poor and the virtual nurse gets pulled in. I'll say we've also had days where the technology is not on our side, and for whatever reason, we're having downtime in the software. And so again, in those cases, from an efficiency perspective, we're certainly moving the virtual nurse back to the unit. And that has been our staffing structure up until this point, is that the majority of our virtual nurses are able to perform both bedside and virtual nursing, as Alisha spoke to.
Thanks so much, Fallon. And like Fallon said, if you want to talk to her additionally about specifics, especially staffing or anything else, please reach out to her. If you're looking in the chat box, her information has been posted again with her email and telephone number. So please don't hesitate to ask additional questions and reach out to her. That concludes our educational program. I want to thank everyone for joining us today. I want to thank Fallon and Alisha again for this wonderful information. If you experienced any issues accessing the evaluation and or certificate of continuing education, please feel free to contact inquiries, send them to Shelley Mikesell at shmi xell@pa.gov. This concludes our webinar. Thank you.